సారీ ఇది స్క్రీన్ చేయరా చేసేసారా గుడ్ మార్నింగ్ ఎవ్రీవన్
చెక్ చేద్దాం మనం
ఇది కొంచెం ఎక్కువ బాగుంటుంది ఇంకొక చైర్ ఉందా ఇక్కడ ఉంది అది థ్యాంక్స్ అండి కొంచెం తలుపు తీసే పెట్టండి మళ్ళీ బయటికి వెళ్ళి తాగొల్లం పెడితే గుడ్ మార్నింగ్ ఎవ్రీవన్ ఇట్స్ లాంగ్ టైమ్ I have seen you all or I have been taking the class that this was because that admissions for this academic year for the MBBS are going on, so I could not take the classes. This class is in continuation with my previous classes which I have covered. What are those topics which I have covered in maternal and child health? Do you all remember? It is about the antenatal care and the intranatal care. Today I am going to discuss about postnatal care. So postnatal care is very important. It is as important as antenatal and intranatal care. So postnatal care depends on the care which is given during pregnancy and during delivery. So if it is uneventful, then postnatal period will be uneventful. So your specific learning objectives, you should be able to define what postnatal care is. This is usually asked in your clinico-social case studies. Please remember, and you can mark it in your books, in your notebooks, the definition of postnatal care. Then you should be able to list the objectives. What are the objectives of postnatal care? You should be able to list 1, 2, 3. And then you should be, usually there are complications during postnatal period. You should be able to describe those complications. These are your 3 specific learning objectives for this class. Introduction. The first 6 weeks after delivery is the postpartum period, and the first 48 hours are very crucial because the women can go into, she may bleed a lot, that is called postpartum hemorrhage, and she can go into shock and death can take place. So the first 24 hours are very crucial, and then which is followed by 1 week. 1 week is also very important for the survival of both mother and the newborn, and usually the complications occur during this period, which is the postnatal period, both the maternal complications as well as neonatal complications. So 60%, there is an evidence that 60% of maternal deaths take place during this postnatal period. Definition. Coming to definition as such, I did not put it totally like what it is. I have put in the keywords which is very very important for you all to remember. Just remember the mother and the newborn. It is the care which is given to the mother and newborn after delivery of the placenta. That is the postnatal care. If you want to define it, it is the time from the time she delivers the baby up to 6 weeks, or you can also say it as 42 days. So there are 2 components in the postnatal care. One is your mother and the other is the newborn. So mother is taken care by the obstetrician and the newborn is taken care by the pediatrician. So the combined responsibility is called perinatology. That is the obstetrician and the pediatrician, they work together. It's a combined responsibility. So please remember, in Viva, if they ask what is perinatology, remember your mother and the newborn and the obstetrician and your pediatrician, and then it is called as perinatology. The care falls in 2 areas, as I already told you all about these things. It is again the slide is repeated, pardon me. So next comes to objectives of the postnatal care. The most important objective of the postnatal care is to prevent complications and to restore the health of the mother as she was in the beginning, that is the optimum health. And also we had the more other important thing is to check for the breastfeeding, whether it is adequate, the baby is getting enough breast milk from the mother. And also that is the time you can talk about family planning services which are given at primary health center and above. And then basic education. Health education is a part of care, any care. So you have to talk about what is good for the mother and the newborn, and also talk to the family about the rest to be given to the mother and how to take care of the newborn. The two components are about the examination of the mother and the examination of the baby. Coming to examination of the mother, like any other examination, it is a general examination and the local examination. Complications what we anticipate during postnatal period. One is the puerperal sepsis. Sepsis itself, what does it mean? It is the septic sepsis during the puerperium, during the postnatal period. So that is called puerperal sepsis. Usually why does it occur? We'll see in the next coming slides. And then the other is the bleeding, hemorrhage. It can be primary as well as secondary. And then the other important complication is when she is not mobile and she just sleeps in the bed, the veins may get infected and it is Thrombophelbitis. And the others to add to the list are the urinary tract infection and mastitis is it is the infection of the breast, which usually occurs because the mother does not take care of the breast when she is feeding the baby. So it can result in infection of the breast, that is mastitis. Puerperal sepsis. I will go one after the other. The puerperal sepsis, it is the genital tract which gets infected within 3 weeks after delivery. Please remember, the baby has to pass through the genital tract to come out. So the infection of the genital tract within 3 weeks after delivery is the puerperal sepsis. What does it happen when there is a sepsis? How do you identify? There is a raise in temperature. When the temperature raises, body temperature raises, there is increase in pulse rate and the puerperium, the genital tract, there is a foul smelling from the genital tract. It is the lochia which smells very badly. It smells a lot. That is foul smelling lochia. Then pain and tenderness in the lower abdomen. Why in the lower abdomen? Why not in the upper abdomen? Because all your genital, female genital organs are located in the lower part of the abdomen. That is your uterus, fallopian tubes, vagina, etc. So they all. That's why the women complains of pain in the lower abdomen, and when you touch the lower abdomen, it's so tender. Then you can suspect sepsis, puerperal sepsis. And then the birth canal infections is the cause for it, and urinary tract infections is another important cause. You had to remember these two important things. Then you had to, so how can you avoid it? How can you avoid sepsis? It is by ensuring that, I already told you all in the intranatal care, every birth, every delivery should be attended by an skilled birth attendant. Who is the skilled birth attendant? I have already mentioned to you all. So just go through your notes and you will get, you'll try to remember. Or you, once you open the notes, you can just read once so that it will be like reinforcement for you all. Particularly, it's important when the women wants to deliver at home. I told you all the advantages and disadvantages of the home delivery. Coming to hemorrhage, postpartum hemorrhage, the definition of postpartum hemorrhage is any hemorrhage that occurs after delivery of the baby up to 6 weeks. There are two main types. One is primary, the other is secondary. The primary is one which occurs within 6 hours and the secondary is after the 6 hours to 6 weeks. Here, when you look at this slide, you are seeing 666. Is it not interesting? postpartum period is up to 6 weeks, then your primary hemorrhage is from up to 6 hours and your secondary hemorrhage is from 6 hours to 6 weeks. It's so easy to remember. So just remember your number 6. Okay, come on, let's go. Then thrombophlebotitis. I was telling you all how thrombophlebotitis occurs when she is not mobile after the delivery. She will be sleeping. Especially this happens in cesarean cases. They are so much afraid to move from the bed. They are afraid that their sutures may open. So you have to educate them and you have to ensure in front of them to help the mother to take her to the washroom so that she will get the confidence that she can walk. So the infection of the veins of the legs, especially what are the veins? It is in the calf muscles and it is usually associated with varicose veins. And then when you look at the legs look pale, they are swollen, and when you touch it, they are tender. That is thrombophlebotitis. Others, urinary tract infections and mastitis. I told you all about it. Then coming to restoration of health of the mother. This is the second objective. You have to ensure that the mother, the woman feels that she has recuperated physically and emotionally from her delivery. That's very important because she should not feel that she has lost everything after the delivery. No, it's not correct. You have to assure her that, and you have to ensure that she is physically and emotionally she comes back after her delivery. Then the areas of the care falls in 3 divisions. One is the physical health. Physically, she should feel that she is normal. Psychologically, she should feel that the child is not a burden to her, and then she should start accepting the baby, and the social support from the family level, community level. Postnatal examinations. These are very important. These are asked in your clinical social case study. If you get a postnatal case, one is the first 3 days, the examination of the women who delivers should be done in the morning and evening. That is 2 times a day for the first 3 days because they are very crucial. I told you all why it is. And later, once in a day till the umbilical cord falls. Usually the umbilical cord falls 1 week after delivery. And then later for the next 6 months, it can be just once in a month, or it can then later for 1 year, once in 3 months, 2 to 3 months. Then what do you do when she comes, when you examine her, or when our health worker goes to her house to examine? She has to see for the anemia, whether the women looks pale, because hemorrhage is one of the important complications which we anticipate during postnatal period. So, if she is very pale, if she looks anemic, routine hemoglobin examination should be done. That is usually done at primary health center, and sometimes it is done at sub-center also. And if she is anemic, the treatment should giving the postnatal mother the required iron and folic acid for the required period, depending on the level of hemoglobin, which I have already taught you all in during your antenatal care. So, if necessary, it can be continued, the iron and folic acid prophylactic can be continued for 1 year or more, depending on the level of the hemoglobin. Then nutrition education. Why education on nutrition, especially during postnatal care? Because the mother has to feed the baby. So, she needs more extra calories, proteins, and then her fats, the vitamins, minerals, etc. So, you have to educate, because the mother, the newborn, the mother do not know about the extra calories required. Of course, in all the cultures, it comes in as tradition that they want to give some special good food to the women who delivers. But this is not there in the poor community. So for the poor community, what you have to do, I will tell you, or how you have to link them to the center where they get some supplementary food. So for all malnourished mother, she may secrete same as much breast milk as a well-nourished mother, but at the cost of her health. So you have to provide her extra nutrition. And then what does it, the family budget is not sufficient, it is limited. So you have to show the mother, demonstrate, the health worker should be able to demonstrate that how she can make better food with the less money. There are many ways of doing it, and it should be culturally acceptable. Like growing of foods, a kitchen garden, some leafy vegetables, and papaya plant, can be just grown by using domestic wastewater. It does not require even fresh water. So if they just plant a papaya, then they can it grows within 6 months and gives fruits. And the plant usually it will give so many fruits. Each plant nearly gives around 15 to 20 papayas, and that can be consumed by the whole family. And then she can also think of poultry, wherein she can get eggs freely from the hens, and then that is the protein which she can consume at family level. Then the exercises. See, usually you see the women talking among themselves, saying that I have delivered, but later after my delivery, then I feel that I have lost everything. I don't feel that my muscles are like so flabby and all. That is because they are not told about the postnatal exercises. The postnatal exercises are the stretched abdominal and pelvic muscles, and it should be started immediately after delivery. It can be done as many times as possible in a day, so that the woman comes back to her original shape, original position, everything, and she feels good for herself. And then there is normal gradual resumption of her duties, though after her restoration of her figure. Then number and timing of visits by the health worker. This is if the women delivers in a primary health center or in a first referral unit, discharged after 48 hours. Then there is here I have put a table showing that two things. One, a women who delivers at home or sub-center, then the women who delivers at PSC or a first referral unit. So here I will start from the first visit. First visit is usually within 24 hours, which I already mentioned, and the second and third visit are on the third and seventh day, but the fourth visit is again 6 weeks. Please remember these 4 visits which are asked in the clinical social case as well as in your Viva. So there are also for the low birth weight babies. Who is a low birth weight baby? A baby whose weight at birth is less than 2500 grams or 2.5 kg. For them, the health worker has to provide 3 more additional visits in addition to these 4 visits. So there are 7 visits for a baby who is born with birth weight less than 2.5 kg. That is after the 4th day, it is the 14th, 21st and 28th day. That is after the 7th day, 14, 21, 28, and your last visit will be on the 6th week. So please remember that. Please make note of this table. You can make on your own. It's not a big deal. Then what does the health worker do during the postnatal examination? She will look for the signs and symptoms of hemorrhage and sepsis, and also she will advise the mother to feed the colostrum, which is the first milk which will come out of the breast. That is, the colostrum has, you all know, you might have learnt in pediatrics that it has antibodies as well as proteins. So it is very good for the newborn, and it is natural. So the baby has to take this, and you have to tell. And you also should educate the health worker should educate about the exclusive breastfeeding. What is exclusive breastfeeding? I will tell you all that it is once the baby is born, the baby starts breastfeeding. Starts breastfeeding till 6 months. The baby is given only breast milk, nothing else. No other pre-lacteal feeds. And advice to the couple on family planning, which I already told. And it's always, you must ensure that the health worker should ensure that the mother keeps the baby warm and also take care of the umbilicus, skin and eyes. The health worker, when she visits, she will see the umbilicus, whether it is clean, looks for the skin, whether any rash is there, and looks for the eyes, any infection. These are the things which the health worker does when she goes to the house of a woman who delivers to give the postnatal examination. And then she will also ensure whether there is good suckling while breastfeeding, and screen the newborn for danger signs. If there are danger signs, she will refer the baby to the nearest hospital, and she will advise the mother as well as the family members on immunization. You all should know about the immunization schedule. It's asked in exam as a theory question as well as in viva. So at each postnatal visit, she will check for temperature, then the pulse rate, respiratory. These are all vitals, and then examines the breast and also checks whether there is normal involution of uterus, and then in lochia whether it is foul smelling, and check for the urine, bowels, advises on the perineal toilet where the stitches are done if it is an episiotomy. And then immediate postnatal complications are kept in her mind, and at the end of the 6 weeks she will ensure that the uterus is involuted well, and then she will visit her, as I told you all, once in a month for 6 months, and then once in 2 to 3 months up to 1 year, which I already mentioned to you all. So the health worker should at least make 3 to 6 postnatal visits to the home. And then the common conditions. In the late postnatal period, there may be subinvolution of the uterus, or it can be retroverted, a prolapse of the uterus can occur, and then infection of the cervix, that is cervicitis. These all you will learn in your OBG, obstetrics. Then psychological factors are peculiar to a recently delivered women. There is a fear which is generally because of the ignorance and timidity and insecurity. She may think that the baby can be taken away from her, and she feels insecure. All these things should be eliminated, and proper prenatal instruction should be given by the health worker. So the husband should always support her and give companionship, and it is usually psychosis is precipitated by birth of the baby, and it's very uncommon. It's not common. Psychological effect is uncommon. And the most important thing is your social factor. So the mother, she is very new, so especially after the first baby is born, and so everyone should support her, the family members, and the wholesome family atmosphere should be there, and especially from the husband who has to give her confidence. Then breastfeeding, it's an excellent opportunity to keep, it's like a binding between mother and the baby, and it helps in regular feeding of the baby, and gives the nourishment required for the especially for the first 6 months of the life. And then when breastfeeding should be initiated, it should be initiated within 1 hour after birth, and exclusive breastfeeding for the first 6 months, but it can be continued up to 2 years. Lactation is important contribution to child's nutrition, because it is just nature, ready-made, and it is natural, and it's low cost. It can be afforded by everyone. It's not a burden on the budget, family budget. And then it will contribute to reduction in poverty. They don't have to buy baby formulas if they start the baby on breast. And then because of the poor environmental sanitation in especially in the people who are below poverty line, then bacteriological dangerous, all these are prevented once she gives the breast milk to the baby. So it's very important. And the other important question which is asked in the Viva is about, and in your clinical social case study, is when is the breastfeeding week celebrated? It is in the first week of every year. Please remember, first week of every year. Usually an Indian woman, she secretes 400 to 600 ml of milk per day in the first year. Then about the family planning, it's very important. You should talk to the women and her husband and family members about the contraception. So it is related, and you should tell it is related to every phase of our maternity cycle, and you have to see that she is motivated at every attempt she attends the postnatal clinic, and a suitable method which is chosen by her. It's not chosen by us to limit the family if it is more than 2 children, or space if it is the first delivery. And then if they want to go for permanent methods, it is usually the tubectomy, which is done on the second day after delivery, that is postpartum sterilization. Even husband can undergo vasectomy. And lactation confers some protection against contraception, but it is not 100% sure. So they have to use some contraception to prevent next pregnancy. These contraceptives are usually supplied immediately in the postpartum period. The contraceptives that will not affect the lactation has to be chosen. They are usually IUCD, and it is non-conventional, non-hormonal. It should not be hormonal, which should be given for the first 6 months, because if you give the hormonal contraceptives, the breast milk is, secretion of the breast milk is affected. Then basic medical education. Basic medical education, we have to educate them about the hygiene. I told about feeding, nutrition, contraceptive. Health checkups are important. The most important thing which we doctors never speak is about the registration of the birth. You had to tell the mother about registration of the birth, which is a must for every child who is born. You all know the importance of registration of the birth. I don't have to tell you all. And then about the requirement of energies, which we will be taking you all in the clinical social case studies. Then about the lactating mothers, vitamins, and then coming to the newborn Apgar Score, which you will be learning in your pediatrics. There are 5 things on which the Apgar Score depends. That is starting from the rates, that is heart rate, respiratory rate, then your tones, muscle tone, reflex, colors. The total is 10, and they are divided into like 0 to 2, and the maximum score is, the best will be if they are like total score, severe depression 0 to 3, mild 4 to 6, no depression, it is 7 to 10. So we want all the babies to be between 7 to 10. Then motor reflex, it is, you all will be learning in your pediatrics. It is spreading out the arms and unspread the arms, abduction and crying. It's important. Then breastfeeding, I told you all. Then this is important for every poor woman who comes to, whom you will come across. You have to ensure that they are registered in the Anganwadi center. They get a free meal. They get every lactating mother is given supplementation at the Anganwadi center, and the meal covers around 600 kilocalories per day and protein of 18 to 20 grams per day. This is asked in your Viva as well as in your postnatal clinical social case study. then registration, then iron and folic acid supplementation. Summary. This is the care given to the mother as well as to the baby after birth. Then it has two components, mother and child. You have to promote exclusive breastfeeding, family planning, education. Thank you all very much. Any questions you can pose to me and I will be happy to answer you all. Thank you once again. Have a good day. Bye.